The information in this video is provided for informational and educational purposes only. Hey everybody, welcome to another edition of the Morale Monologue. My name is Michael Morale. Okay, so over the past couple of months, I've done numerous videos regarding Spinraza and Evrysdi and even Scholar Rock's potential treatment that they're developing called apitegromab. But today I want to focus this video on Zolgensma, which is a Vexasis gene replacement therapy for infants and toddlers 2 years of age or younger. Basically, Zolgensma is an IV infusion that replaces the SMN1 gene in these children. And while it's a miraculous treatment, they recently encountered a few issues that I think you need to know about. There's a blood disorder called TMA, and so Zolgensma has had to update their safety label with regards to this information. And that's what I want to talk to you about today. The company that I work for, BioNews, is the parent company for SMA News Today. And recently, SMA News Today produced a great article regarding this safety label, and I put together about a 3 to 4 minute video where I detail some of the information within this article. And while I only touch on the key points in this article, I will link the article down in the description of the video. So please make sure that you go down and click on the link and read the entire article for yourself, and make sure that you show it to either your child's doctor or give it to the family of a child that's taking Zolgensma so that they can share it with their doctors. All right, so take a look at the video, and then afterwards I'll come back and I'll give you my final thoughts. Thank you. Novartis Gene Therapies has added thrombotic microangiopathy, a rare condition characterized by blood abnormalities, to the list of safety concerns with use of Zolgensma in children with spinal muscular atrophy. This decision was driven by reports of 6 confirmed cases of TMA within 1 to 2 weeks of the gene therapy's single dose being given to children 4 months to 4.5 years old between October 2019 and February 2021, a company community announcement stated. 3 of these cases were described in a case report study published in November 2020. All children with this serious complication were given supportive or specific treatment, and all of these cases were resolved. We continue to monitor product safety, including long-term safety follow-up studies in patients treated with Zolgensma. Novartis Gene Therapies, formerly known as Avexis, stated, "The therapy's benefit-risk profile remains favorable, and reported adverse events are monitorable and manageable." Administered directly into the bloodstream at a dose proportional to a patient's body weight, Zolgensma is available to SMA patients up to age 2 in the U.S. and to babies and young children up to 21 kilograms, about 46 pounds, in the European Union and Canada. It uses a modified and harmless virus to deliver a working copy of SMN1, the mutated gene in SMA, to cells. Due to the body's natural immune reaction against the carrier virus, the therapy can only be given once. The reason why Zolgensma can only be given once is due to the body's ability to build antibodies. Zolgensma is administered intravenously or through an IV infusion directly into the veins. Zolgensma has the ability to get through the blood-brain barrier, which is the reason why it can be delivered intravenously. The body's blood-brain barrier is a defense mechanism that keeps harmful bacteria and other illnesses from entering the central nervous system. Even though Zolgensma is a wonderful treatment, if it's given more than once, the body will recognize it as a foreign material, and when this happens, the body will produce antibodies to try to keep it from going directly into the central nervous system. Notably, the single dose may still promote an immune response, which can increase the levels of liver enzymes, an indicator of liver damage, and drop those of platelets, tiny blood cells responsible for blood clotting. For that reason, an immunosuppressive regimen should be started on the day before treatment, with liver health and platelet counts monitored prior to treatment and at regular periods thereafter. TMA, a rare disorder, is characterized by the destruction of red blood cells, known as hemolytic anemia, low platelet counts, known as thrombocytopenia, and the formation of blood clots in small blood vessels that can injure the kidneys. Parents and caregivers are recommended to seek urgent medical care if a child shows any signs or symptoms of TMA, such as unexpected bruising or bleeding, high blood pressure, seizures, or a drop in urination after receiving Zolgensma. Symptoms of illness, such as a fever or vomiting, should also prompt medical attention. If thrombocytopenia is found in regular platelet lab tests, which are recommended, further tests for hemolytic anemia and kidney health should be undertaken. Novartis Gene Therapies proposed adding TMA to the therapy's prescribing information in all countries where it has been approved. Updated warning labels are in place in several of them, including the US and those in the European Union. The company is also directly informing healthcare professionals of this update and the need to be aware of TMA risk. More than 1,000 children have been treated with Zolgensma worldwide across clinical trials, managed access programs through which patients can access the therapy before its approval, and in commercial settings since January 2021, Novartis Gene Therapies reported. Okay, so I hope you enjoyed the video, and I hope you got some information out of it that you can use as well. If you're the parent of a child or a caregiver of a child that is either taking Zolgensma or about to start Zolgensma, make sure that you fully understand the safety label that I went over in my video, and also be sure to talk about this safety label with the child's doctor, because this is very important information that all of you need to know about. If you enjoyed this episode of the Morale Monologue, give me a thumbs up, and please subscribe to the SMA News Today YouTube channel as well. We would greatly appreciate it. Remember, when you do subscribe to the channel, be sure to click on the bell icon. That way you'll be notified of all new videos that we produce. We at SMA News Today hope all of you have had a fantastic day. Do me a favor this upcoming week, do something for yourself that's going to make you a better person. Until next time, take care of yourself, and I'll talk to you in a couple of weeks. Bye-bye.